Thank you everybody for joining us. It's 3:30. Today is Thursday, February 25th. We'll go ahead with our QC COVID-19 press briefing. Today you'll be hearing from Nita Ludwig, Administrator with the Rock Island County Health Department, as well as Ed Rivers, Director with Scott County Health Department. Why don't we go ahead and start with our reports of data for the day. We'll go ahead with Nita.
Hi, good afternoon. Today in Rock Island County, we are reporting 18 new cases of COVID-19, and that brings our total now to 12,831 total cases. 17 people are currently hospitalized in Rock Island County with COVID-19, and we don't have any deaths to report today, so our death total remains at 304 for the county. Thank you.
In Scott County, Iowa Department of Public Health reports 18,214 positive tests in Scott County, and our deaths are at 205. There have been 32,100 doses of vaccine administered in Scott County, with 7,100 being second doses or completed series.
Okay, now we'll hear some prepared information starting with Nita Ludwig.
Starting today, the Illinois Department of Public Health is opening vaccine opportunities to Illinoisans with specific underlying health conditions that include cancer, chronic kidney disease, chronic obstructive pulmonary disease or COPD, diabetes, heart disease, immunocompromised state from a solid organ transplant, obesity, pregnancy, pulmonary disease, and sickle cell disease. As you can imagine, we are pleased to be able to offer vaccine protection to people with these serious health conditions. However, we are worried that expanding eligibility without greatly expanding our supply will lead to more frustration in getting an opportunity to be vaccinated. We continue to ask for your patience. Adding thousands of people to the pool of those seeking vaccination will make getting a time slot more difficult. We are trying to manage your expectations. You will have a chance to receive your vaccination, but you could be weeks away from getting a time slot at one of our clinics or even from one of our healthcare partners or pharmacy partners. Please understand that public health and our partners are working hard on your behalf and that this process is frustrating for all of us. We ask people with only those that are eligible to seek a vaccination time slot. We can serve healthcare providers, frontline essential workers, Rock Island County residents 65 and older, and now people with those outlined serious medical conditions. Please bring verification of your diagnosis to the vaccination clinic. Verification documents include an after visit summary from your recent medical provider visit. It could be an explanation of benefits from your insurance carrier. It could be a list of your medical benefits. So you may also have to ask your medical provider for something with a diagnosis on their letterhead. That would be fine as well. Because vaccine supply remains limited, the state health department is still directing us to give as many second doses as necessary. We offer second doses at 10 a.m. to 3 p.m. on Thursdays, and then any remaining slots will be offered on Friday morning at 10 a.m. on our website and on our Facebook page. And as we've said in past weeks, we suggest that you do click the link on the Facebook page because the social media giant servers are less likely to crash with so many users. You do not have to have a Facebook account to search for our health department webpage and then click on the link. The link for Thursday and Friday opportunities are different. We are still using Sign Up Genius at this time for these slots. You do not need to sign up for a Sign Up Genius account to be able to get an appointment slot. For first doses, just click the slot and put in your name and email address, and then make sure to click Submit. For second doses, You still don't need to sign up for an account, but you will be asked when you had your first dose. This information is available on the vaccine card that you received with your first dose, and we also recommend that you take a picture of that vaccination card so that you always have it with you. Then you will need to still put in your name on the Sign Up Genius link and your email to register for a time slot. Thank you.
As has been the case during many points in the pandemic, the response between Iowa and Illinois differs. In Iowa, we had not yet moved into phase 1C when persons with underlying health conditions become eligible for the vaccine. We are still early in phase 1B with the 65 and older population and 5 tiers to move through. We know this continues to be frustrating for many in our community, but we ask for your patience and are hopeful that the supply of vaccine increases, allowing us to move through these tiers more quickly. People in the 65 and older priority population are eligible for vaccine throughout phase 1B. The limited vaccine supply coming to Scott County for that group continues to be given to our 3 main health system partners to be administered through their clinics. CASI continues to help connect seniors without a primary provider or independent providers through those health systems. However, with such a low supply, having a provider does not mean you will get the vaccine quickly. And if you work with CASI, that also does not mean you will be getting vaccine quickly. It will still take time because we have far fewer doses than the number of 65 and older persons who would like the vaccine. We will also be vaccinating Tier 1 priority groups. These groups help support the foundational infrastructures in our community, our schools, child care systems, and first responder agencies. We know that Tier 2 is quickly approaching. Those who qualify are persons with disabilities in home settings who are dependent on others for primary care and that primary care staff. Also, frontline essential workers in the food, agricultural, and manufacturing sectors who live or work in settings where social distancing cannot be achieved. Additional guidance was provided last week addressing frontline essential workers in that Tier 2. There may be some cases where workers in a facility may qualify for a vaccine based on this definition, while others do not. Workers in departments or areas within a qualifying facility who can social distance will not be vaccinated in phase 1B. We are working to identify the facilities and workers qualifying under this very narrow definition. We'll be reaching out directly to businesses as we work through the process. Essential workers and businesses outside of this definition are not yet identified in phase 1B or 1C. Please continue to watch our website for updates on future priority groups as they are determined by the state of Iowa. Additionally, it was mentioned on Governor Kim Reynolds' briefing today that they are working to provide a one-time additional supply of vaccine to Scott County to be given through our clinic. We welcome any opportunity to bring additional vaccine into Scott County, and will work with the Iowa Department of Public Health on the logistics of the vaccine and how it will be quickly administered in our community in the upcoming days. We'll share more information as we have it. We know the limited vaccine supply is creating a slow rollout and leading to many frustrations, but we'll continue to move as quickly as we can with the vaccine we're allotted each week.
Thank you, Ed and Nita, for that information today. If our media partners on the call have any questions, please type those into the chat now before we end the briefing. Okay, question for you, Nita. You might have seen it in phase 1B in Illinois. Is the county going to stop folks in that category from signing up until they feel like they have more of the phase 1A folks vaccinated? And how are you planning to control who gets what now that the state has opened the second phase?
Sure. So phase 1A was really healthcare workers. And we do feel like we have gotten through all the healthcare workers in our county. We feel like they have had the opportunities to be vaccinated, and most of them, I believe, have been vaccinated. And as far as phase 1B, yes, it is expanded. And as I mentioned earlier, that's a lot more people that are eligible now than we have vaccine. And so that does become a little bit more difficult again to get those all important vaccination appointments. However, this is the state of Illinois guidance that anybody that fits into phase 1B or 1B expanded now with all those underlying medical conditions, they are all eligible, equally eligible, and we do not prioritize further beyond that. So they are all eligible. If they sign up to get a vaccination spot, we will be checking when they check in for their registered spot what their diagnosis is, and that to be sure that they do meet the eligibility to be vaccinated.
And then Nita, in a follow-up to that, will both type 1 and type 2 diabetes be included in Illinois' eligibility?
I don't believe it has been defined differently. So yes, I believe anyone with diabetes can be vaccinated at this time.
Question, do you feel the start of phase 1B should have been pushed back?
Well, I mean, we certainly want to vaccinate everyone who wishes to be vaccinated. It's just frustrating for the public and frustrating for us not to be able to have enough vaccine to really open it up as widely as we would like. But we do expect that to keep continuing to increase in our county. As you know, there's a Johnson & Johnson vaccine that may likely be approved even yet this week. And that could certainly help if we get those vaccines rolling out. So, we're happy to vaccinate people. We want everyone to be vaccinated. So that's good news.
Okay, at this point, it doesn't look like we have any additional questions that you haven't touched on. So we will go ahead and conclude today's briefing. The recording, as always, is available on our website, and information will also be on our social media pages. So please check there for more information. Thank you, everybody, for joining us this afternoon. Thank you, Ed and Nita, for your time today. And we'll look forward to talking with you all again next week.
Thank you, Brooke.